Okay, so first I would verify my physician's orders, and then I would gather all my supplies, and then I would come into the room and introduce myself. Hi, I'm Nurse Emily, and I will be doing your wound care today. And can you verify your name and date of birth for me? Okay, and then I would provide privacy, and then the first thing I would do is wash my hands, and then I would put on clean gloves. We'll be taking the dressing off first, so I would stabilize the skin and pull towards the wound on both sides, and then once that is off, we would look for odor, consistency, color, and the amount of drainage on the dressing, and we would discard that. And then there would be 2 other dry gauze pads on here that we would discard, and then we would pull out the gauze from the wound, and we would assess it for the drainage and the color and odor, and then making sure we get all of the gauze from the undermining and assessing those, and then making sure we get the tunneling as well. And then after we assess all of the gauze, we would measure the wound and assess the wound. So without touching the skin, I would measure, and I'm measuring about 10 centimeters by 8 centimeters. And then we need to measure the tunneling and the undermining.
The drainage, when you're irritated. Okay,
so first I would measure the tunneling.
No, you're fine, because you're going to put this over here.
Stabilize the skin and pull the dressing towards the
So I got about 4 centimeters, and we would throw this Q-tip away and get a new one.
But you're going to, when your person's on this side, I mean, you're going to be,
And then we would measure the undermining.
yeah, you're going to be fine, because I can't, you're not going to dump
And then I measure that at about 2.5 centimeters. And then we would need to get one more clean one.
Amy and Diana, if you guys are doing manipulating your bombs here,
And then we would measure the depth.
same size you're irrigating, you are doing what? We were totally contaminated. No. I mean, if you irrigate.
And I'm measuring about 3 centimeters. We throw that away, then I would assess the wound and notice that there is undermining and tunneling, granulation tissue, and then also some bone there and some eschar. And then once we are done assessing the wound and measuring, I will take my dirty gloves off, throw those away, and I would wash my hands, and then we are going to get ready to irrigate. So I would come over here, and the first thing I would do is to get my sterile field set up, and I would open this away from me. My gloves, and then we will dump everything in here onto the sterile field. And then all of my extra supplies.
wash my hands and then I'm going to get everything ready.
Next thing I'm going to do is
And then once I had all of my supplies, I would go ahead and fill up my container with my sterile water. So the first thing I'm gonna do is I'm going to lid it. And then pour it into my container. Alright, and once all of my supplies are ready, I will wash my hands and then I will put on my PPE for the irrigation. So I'd have my gown, my mask, my eyewear, and then I would put on sterile gloves. Alright. So once I got these on, I am sterile. And then, according to the doctor's orders, I have to irrigate with 30 milliliters of normal saline. So I would make sure I have 30 in here. And then I would have my assistant roll the patient for me away from the tunneling, making sure I have a bin here. And then I would irrigate, and then irrigate, and then I would be done with that. So we could discard this. And then once we're done irrigating, we will pat the wound dry. Alright, and then we will just lightly tap around the edges, making sure nothing touches. And then once it's dry, we will discard that. And then now we're ready to take our PPE off. So we remove our gloves. We'll take all of our gear off, and then I'd wash my hands, and then I would put a new set of sterile gloves on.
Would you have the rest of your team? The company slowly underlining it as well.
Alright, so I have my second set of sterile gloves on, and we are ready to start packing the wound. So, according to the physician orders, we have to fill the undermine area with 1 fluff saline moistened 4x4 gauze.
looking for that fluff.
So I would grab a clean Q-tip and I would start packing the underlining. Making sure I don't touch the outside of the patient's skin. And if I did, I would take it out and get a new one and start over. And once that's packed, we will discard this. And then we need to pack the tunneling with the sterile moistened gauze strip. We would grab our other clean Q-tip. And we would pack the tunneling. And then making sure we leave a little tail. And then we will throw this away, and then we will pack the wound bed with 3 moistened gauze. So we would pack the first one.
So I'm gonna cover it with 2 dry, unfluffed. Or next one. So at this point I can use my gloves. I'm gonna wash my hands and use my gloves.
We would pack the second one. And then get our third one.
Go down to the chest. Initial J.
And we would pack the third one. And then to cover it, we will place 2 dry gauze pads on top.
I'm gonna wash my hands. Now we're docking it.
And then we cover it with the ABD dressing.
Okay, because I said right.
And then since the wound is covered, I can go ahead and take my dirty gloves off. And then I will tape the ABD dressing down.
Oh, yeah. Oh, you all set? All done? Yeah, sorry.
And then I would get my label and label the date, the time. This would be sterile. I would label the date, the time, and my initials, and I would put it right onto the dressing. And then I would wash my hands, and I would clean up all of my supplies, make sure the patient is comfortable, and then I would go document.